do you have the prerequisites for an overhead press? This is a question that probably not very many people ask themselves before they perform an overhead press variation. So an overhead press would be a strict military press, a push press, anything, any overhead movement, pull-ups, any of that, chin-ups. Those are all overhead movements, and the shoulder joint, especially this day and age, is a little bit not working very well because we're hunched over, we're in this texting position all the time, we sit a lot, and a lot of people can't get their arms up over their head like so. And so that's number one thing that you want to test for is, can you simply raise your arms up directly overhead? You should be able to see your ear. And you also shouldn't have bent elbows. They should be locked. They should be able to be locked out. You shouldn't have any pinching. If you have closing angle pain, you have a problem at your shoulder joint, and you really should see someone for manual therapy, soft tissue manipulation, or joint capsule mobilization. You should see a physiotherapist, massage therapist, chiropractor, somebody that can sort that out for you before you get into the gym and you start putting weight overhead. Your joint's just not ready for it, and you're gonna end up with a lot of shoulder pain as a result. So that's number one. That's number one test that you can do. Can you get your arms up over your head without any pain here, without bending of the elbow? Check that in a mirror. The other thing you can do is a shoulder car. It's a controlled articular rotation. Not only, maybe you can throw your arms up and you have an arch back, you're compensating from here to get your arm in that position. So your shoulder's actually not getting to that position on its own. It's being helped through compensation in your low back or rib cage flare or whatever. You want to be able to do that without any help from somewhere else. And controlled articular rotation, what I'm going to show you is how to test your full range of motion, where it's at, if you have any closing angle pain, and the full range, so all the way up, all the way around. You check the internal rotation of your shoulder, and this is how you go. So you take a deep breath in, and you irradiate about 30% tension throughout your body. So that's an isometric contraction throughout your body, in your legs, your core, everywhere, because you only want to isolate. You want to isolate the shoulder joint, and that's the only thing you want to move to see if you have control over that joint, over your range of motion, in order to be able to do a press safely. If you don't have control over that joint, you are on the road to injury, and it can be a bit boring to be like, do kind of soft tissue work, mobilization work. It's not sexy, it's not fun, but it's the road to you being healthy for a long time. If you're just interested in quick results, maybe you can get away with it, pack on some muscle, but you're probably gonna get injured, and then you're gonna have to restart and rebuild in the long run, and that's not what you want. So for the car, you're gonna radiate 30% tension throughout. You're gonna raise your arm into flexion. If your arm's out over here, you want it to come up straight. And you're gonna hit your roadblock at the top. No hiking of the shoulder. So if you look in the mirror and you're hiking at the shoulder, you're compensating from your scapula, your shoulder blade, in order to get into full extension. So you wanna keep that down. You're gonna come up high as you can. When you hit that roadblock, there's no bending here. If you have bending, that's a compensation as well. So there's no bending, no hiking. You're gonna imagine there's an X there on your bicep. You're gonna do an internal rotation. So you're gonna internally rotate, just twisting your hand around and back. So the back of your hand comes to your side of your hip, and then you would rotate back around. Trying not to hike, trying to keep your elbows straight, and just rotating those are the things that you should be looking for. If you can only bring your arms up here without bending, there's no way that you should load something over top of your head with extra weight where you're not able to get into that position. So these are the types of things that we're going to look at in our upper body and our lower body lifting technique workshop. It's going to be checking for prerequisites for movement. We're going to check your form. Even if you've been lifting for multiple years, there are many things. There's always something to learn about body position. Your body's always trying to compensate. It's always trying to take the easy way out, and you have to work hard to identify those compensation patterns, usually with somebody else or in a mirror, or looking at what your body's doing and being like, oh yeah, shit, I'm compensating there. And that's ongoing. I've been working now for 10 years and I'm still finding compensations, new ones, they change, it gets better. And to be able to have feedback from other professionals and people that understand how the body moves helps you understand how your body moves, and you can become stronger, more fit, and have a healthy body well into your older years. So this is an opportunity for you to get feedback on your form, have any questions that you may have about certain lifts, and I'm really looking forward to it, and I hope to see you guys there.